You're going for what?
Hey, yo, we're going for woke.
Healthcare is a joke, you know what's leaving us broke.
We're not here to brainwash or be choosing a side.
We're just two Asian guys here to open your eyes. Welcome back to Going for Woke. My name is Calvin Chen.
My name is Aaron Pion.
Yeah, and we are two Asian guys here to open your eyes.
Oh, yeah.
All right. So we are on this journey right now. If you've listened to the previous episode, if you haven't, you may want to go back to listen to the previous episode. We are talking about single-payer healthcare. And today we're going to lay it out specifically. What is single-payer healthcare? We want to talk about what are some of the advantages of it. What is it specifically? What are some second-order economic effects of single-payer healthcare if we were to switch over to that model compared to what we currently have? Okay. We'll also talk about what are some downsides? What are some potential repercussions of the single-payer model? And then we'll kind of dovetail into this next episode from there. But first, I just want to set the tone for why we're even having this conversation anyway. We have a healthcare system right now in America that, for all intents and purposes, it serves some needs and it works to a certain degree. Here's some ways where it doesn't work, and I'm just going to paint by some numbers right here, right? Even if you have insurance, some people don't have insurance. Here's what's going on. Did you know that about 500,000 Americans per year declare bankruptcy because of their medical bills, medical expenses? About 1/3 of Americans have medical debt. That's like 109 million Americans owe money, just are in debt over medical bills. Okay. 10%, a full 10% of Americans owe $10,000 or more in medical debt. There's about 28 million uninsured Americans. 44 million Americans are underinsured. That's about 20% of Americans that are uninsured or underinsured. So it's kind of harrowing, right? Like, how many people do you know in your family? How many friends do you have, right? So if you don't know anyone who's uninsured or underinsured, how would you know anyone unless you're really asking? But if you don't know anyone who's underinsured or uninsured, that means that somewhere else, someone's got like half of their friends or like half of their family or something that is uninsured or underinsured. That's just kind of how the numbers work. And all that in light of the fact that 3 out of 4 Americans don't have enough money to cover an unexpected $500 expense. Okay. In the previous episode, we shined a light on some horror stories about what this current healthcare system has led us to. And the crazy thing, again, I'm not here to demonize anyone. No one, I don't think, is any really like doing this stuff on purpose. It's not like the system itself is intelligent enough to say, well, let's screw America in this way. It's just, this is how the system is set up right now. And Aaron and I both, you know, we're not saying that single payer is the way to go, but it's worth taking a look at because there are some kind of eye-opening advantages and economic effects that are kind of desirable compared to the way it's kind of set up right now. And we've cherry-picked some data right here to show you, but like this data is eye-opening, even though we can point at all the ways that it is working and all the people that it is working for. It's a significant enough amount of Americans to where this is clearly not working for them. If you have, right, like 10% of Americans who owe $10,000 or more in medical debt. Like, think about this. You had some sort of a medical condition that you're currently dealing with. It's affecting your health, your quality of life, and also economically, you're not able to get ahead because of that. And we can see when we take a look at single payer, how some of this is just because of the way that our system is set up. So, Aaron, are you ready to jump into this?
Yeah, for sure. So, yeah, let's talk about it. Let's talk about single payer. And first of all, let's define like what single payer is. So, in our current healthcare system, the insurance company is the payer of the bill, And since we have multiple insurance companies, we have multiple payers, right? So the idea of a single payer is that there's only a single entity, which is the government, becomes the payer of the bill. So basically the government is the single payer. So, that's basically exactly what it is. Um, just want to be clear though, it's the government is taking over the function of the insurance companies. So right now, the health insurance companies, they collect revenue in the form of premiums. They collect a couple $100 a month from people every month. And then they pay out the doctors, whatever the cost of treatment was. So if the government were to take over that function, what they would do is instead of collecting premiums, they would collect taxes, but then they would pay out the doctors with those funds. I just want to make it clear that single payer is not the same thing as socialized medicine, which is what England practices. So in socialized medicine, what happens is that the government directly owns the hospitals, employs the doctors, employs the nurses, and pays them out as well. And they're one notch above single payer. So in single payer, the government is taking over the functions of the insurance company. In socialized medicine, the government is also taking over the function of the hospital employment and the doctor's salaries and such.
So like the horror sort of scenario, if you will, of right, like what if your healthcare system, or like what if your hospitals were run like the DMV or
Yeah,
was run like the post office? That's not what we're talking about right here. It's
that's
not
not what
social.
single payer is. Yeah,
Okay.
that's socialized medicine, and that's practiced in England right now.
Hmm.
We're talking about single payer, which is practiced in Canada and in Taiwan, um, as well as Italy. Just trying to think of the other places that use single payer as opposed to a nationalized health insurance like England
Okay.
does.
So it's not
Yeah.
socialized, like the medical system is not socialized, but it's more, if you want to keep using that word, like it'd be a socialized insurance system for
Hmm.
medical. Okay. Which who said it? Like Andrew Yang said that, if there's anything that the American government is good at, it'd be like writing large amounts of checks and
Yeah.
collecting and dispersing money pretty much. Like that's like
Right.
their core
That's the one
competency.
thing. Yeah.
Okay, got it. Got
Yeah.
it.
So that's
So
the idea.
okay.
And so there's a couple advantages that come with this, and there's a reason why a lot of progressives keep pushing for a single payer. And I'm going to break down the three advantages into three S's, right? So the three S's are simplicity, saving money, and saving lives. So first of all, there's simplicity. Um, right now, we have over 900 health insurance companies. And each of those 900 health insurance companies have their own CEO, their own rules, their own policies, their own what gets covered, what doesn't get covered, which is why there's so much confusion around our healthcare system. So we go back to the last episode, we talked about that Florida man who just wanted to get his symptoms checked out to make sure it's not COVID. And then he gets charged a full price because it turns out his particular health insurance company didn't cover that because he wouldn't produce 3 years worth of medical records. So there are
Mm.
some health insurance companies out there that require you to produce 3 years worth of medical records just to get some things covered. Last episode we also talked about how people go to an in-network hospital, but they get treated by an out-of-network doctor. So then they get given the full like $60,000 bill.
Even though they have insurance, they're
Right.
paying non-insurance rates because of
Right.
that. And you said that what was it, like that happens to like 42% of Americans
Right.
who go to the
42%.
insurance room or the,
Absolutely.
the
Yeah.
emergency room? Yeah.
Yeah. 42% of emergency rooms, and because this is by design. Right. So, but then again, there are some insurance companies that also help you pay for at least a part of your out-of-network costs, because this sort of
Okay.
thing happens. But so, anyways, my point is there's over 900 health insurance companies. I mean, think about it this way, man. Like you go to In-N-Out, and imagine if there were 900 different choices for burgers like on the menu. How confusing that would be. And yet when it comes to our health, like, and our health insurance, there's 900 choices for it. So of course it's overwhelming. Of course there's all sorts of things going on there.
I can imagine that'd be really expensive for In-N-Out to run too. Like it's not very cost
Yeah,
effective for them to like, oh damn, no
exactly.
one's ordering enough of like this burger right here. That stuff is like rotting now or
Yeah.
something. Like I can see how that like how the simplicity could end up saving a lot of money.
Oh yeah, absolutely.
But I
Um,
guess that's the next point. Sorry. Kind of getting ahead here.
oh no, for sure. But yeah, so this is why, because of this crazy complexity in our current system, family doctors are unpaid up to 30% of the time. And the reason I bring that up is this complexity. It doesn't just screw over the customers, me and you. It also screws over like well-meaning doctors who are just trying to get paid for the services they provide. But because each insurance company has its own technicalities and its own loopholes and its own paperwork and little rules you have to play by, yeah, you got up to a third of family doctors getting unpaid, or family doctors getting unpaid up to a third of the time,
Damn.
as opposed to Canada, which uses a single payer. Their family doctors only get unpaid up to 2% of the time. So that's another thing to keep in mind is just the simplicity. It's not that, like, you know, having choice is a bad thing, but sometimes too much of a good thing is bad. And 900 choices is obviously, goes into the not very good anymore territory.
Yeah. I mean, so I believe in people having choice, and also I believe that like it's not like I'm really like, oh man, I wish I had more health insurance companies to choose from. You know what
Yeah,
I mean? Like
yeah,
I don't ever sit around like, hey, let's like re-examine my health insurance so that I can like exercise my choice. I just want it done. And so I mentioned it before, I'm a coach, right? And you see very often that a lot of times that complexity is like the enemy of execution. So the more simple it is, like the easier it is just to execute, get the thing done, have it working, and then there we go, right? And we see this comparison right here. A third of the time, doctors get unpaid, or at least up to a third of the time. Compared in Canada, 2% of the time, that's like a 30% difference.
yeah,
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 that's a lot of
exactly.
money. That's a lot
That's
of
a lot of
money for
money.
doctors.
That's a lot of money.
Yeah.
So yeah, so number one, the first advantage of single payer is simplicity. The second S is it saves money. So again, let's go back to the over 900 health insurance companies we have right now. And each of them has its own CEO, has its own accounting department, has its own sales and marketing team, um, which is why over 1/3 of our healthcare costs are actually administrative costs. And that ends up costing us over $800 billion every single year. So 1/3 of our total healthcare costs, over $800 billion every single year. And the idea is, if we were to have single payer, we're consolidating all 900 health insurance companies into one health insurance company, which is the government. So we don't have to duplicate these costs over and over and over again, 900 times.
Mm.
And this is why, again, pointing back to Canada, because they're a North American neighbor and they use single payer, their healthcare administrative costs are 4 times lower than ours.
4 times lower than ours.
Right.
Well, the administrative costs.
The administrative costs. Yeah. So I'm
Okay.
saying, we spend $800 billion a year on healthcare administrative costs right now.
Hmm.
So I guess, yeah, 4 times lower than that, that would be $200 billion a year.
Well, and like that's like we're all paying for that somehow, conceivably, yeah, through taxes or out of our own pocket in our premiums.
Right. Right.
Hmm.
Exactly. Those 800
Okay.
bucks, $1 billion, we're paying for it right now.
Yeah. And by the way, like, so part of me is kind of like, okay, but if you were to consolidate all that, that means that all those CEOs, admin people, sales and marketing people, like they'd be out of a job. Maybe if we were to
Yes.
consolidate all that,
Yeah.
we're gonna talk about that in a little bit. Like, what's the other side of that?
Yeah. Yeah. No, definitely. We'll cover that for sure. So just hang on to that thought and we'll cover it in a bit. So first of all, we save money because we're consolidating the administrative costs. Second of all, we're also saving money on the pharmaceutical side. So right now we spend $480 billion a year on pharmaceutical drugs. And when you compare how much we spend per person on pharmaceutical drugs versus the rest of the world, we spend twice as much. And the reason for, and again, I'm gonna keep using Canadian examples just because I feel like it's an easy comparison. Insulin is 10 times more expensive in the United States than it is in Canada. And insulin, if you're a diabetic, you need insulin to live. And so to charge 10 times as much for that in America, as opposed to you just fly over the border or drive over the border and pick it up for 10 times cheaper, you know, it's crazy. And here's the thing about single payer is what happens is, again, when you have this one government entity that has all this leverage, then they're able to force the insulin manufacturers to compete against each other to offer us a competitive price. Because what the government would do is they would go to, you know, insulin maker A, B, and C and say, hey, I'll give you access to all 300 million customers, but you have to give me the lowest possible price. And that's what would, you know, give us the leverage to drive down pharmaceutical costs. So that's the second source of money saving. So you add the administrative and the pharmaceutical savings, and there's a couple other smaller things which I won't mention, but like, well, for example, like emergency room visits right now, where we're covering out of pocket for other people who don't have insurance, like that sort of thing would go away. But let's just focus on the administrative and the pharmaceuticals. And this is why there have been multiple studies done on, okay, how much would we save every single year if we were to implement single payer? Yale came out with a study saying we would save $450 billion every single year, right? So that's like $500 billion every year. But let's say you think Yale has a liberal bias and you don't really agree with them. Okay, let's go take a look at the conservative side. There was a study funded by the Koch brothers, and Koch brothers, they're super conservative, libertarian, right-wing. They funded this right-wing think tank to see, you know, what would happen. And even they admitted that single payer would save us $200 billion every single year.
Damn. So, I mean, that's like a scale of number that I personally am not, I guess, educated enough to like. I mean, obviously, that's a lot of money, right? I'm like, dude, give me like 1% of that. We're good. You know what I mean?
Mm-hmm.
But I mean, no, obviously, it's not like money that's going to come back to me. That's just like money that we're saving overall as taxpayers or whatever in the government, right? Like, what could the government do with 200 billion? Like, do you have a sense of what that, like, what are some, like, give me an example of what we could do with 200 billion?
Yeah, so let's talk about, like, for example, UBI, when Andrew Yang was proposing it, when he crunched out on the numbers. So UBI, universal basic income, the idea is you give every American citizen 18 or older $1,000 a month, right? Yeah. So it turns out that would cost us, I think it was $2 trillion per year to be able to do UBI. So if you just take that 2 trillion and you divide it by 4 to get to the Yale number of $500 billion a year, that would mean like every American would get $250 a month for the full year.
Got it.
That's one way to think about it. Yeah. Okay. So $250 extra bucks in your pocket every single month, based on the savings that it generates. I don't know if that makes it tangible.
Yeah, I mean that's pretty tangible. I don't even know what I was really looking for, Aaron. When I asked that, I was like, could we get like a solar panel on every roof or something? But you know what I mean? Yeah. But like $250 a month coming to you from the American government, like that's what the government would be able to do if they chose to go that way. What they're saving with single payer. I mean, that at least kind of gives me a reference point. You know what I mean?
Yeah.
Yep. Yeah. Okay.
So we talked about, it simplifies the system, it saves money, and the third advantage is it saves lives. So right now it's estimated about 70,000 people die every year due to a lack of access to health insurance. And it makes sense because right now there are 28 million uninsured Americans. And so all Americans would be covered, so these sort of deaths would no longer need to happen. And to prove this out, Massachusetts actually, Massachusetts implemented a statewide universal health care. I think it was Romney Care,
That was
if I'm
Romney
not
Care, right?
mistaken. Yeah.
Yeah.
And
Yeah.
then and they were able to prove that their death rate actually was lowered by 4%, I believe, after instituting that statewide universal health care. So bottom line, it would save lives. So it simplifies everything, it saves money, and it saves lives.
Yeah.
Yeah, so those are the three S's, the three advantages of single payer.
Hmm.
Mm-hmm.
And so it's simpler, saves money, saves lives, and like that's like the immediately that's what we would see,
Right.
right? And let's talk about, okay, like what are some of the second order effects of it? Like what, like economically, like what does that lead to?
Yeah. So let's talk about the three secondary effects, mostly tied around our economy. So that one we can break down into three I's. Number one is increased pay. Number two is increased number of jobs, and specifically increased number of healthcare jobs. So we'll talk what you talked about earlier. And number three is inspire entrepreneurship. So
Huh.
so let's talk about the increased paycheck. Right?
Yeah, because
So
I'm kind of curious. Like, I would expect that for some reason I feel like it would kind of like end up costing me more, maybe in taxes or something. But how does this lead to like increased, like a bigger paycheck for me?
yeah, so let's go over that step by step. So first of all, there were multiple studies done on corporations and how much they spend on healthcare versus how much they've spent on compensating their employees. And what they found was, in the private sector, at least, dollar for dollar, every dollar of increase there was for healthcare costs, there was a dollar decrease in wages. Because if you think about it,
Yeah. Okay.
that's your total compensation of your employees, right? You give them a base salary, but you also give them health benefits. Now, to be clear, it's not like your employer is going to go up to you and say, hey, healthcare costs went up this much, this past year, so we're going to cut your paycheck by that exact amount, right? It's not like that, but it is gradual, as in, as there's turnover within the company and they reopen that position, they're going to start off with a lower salary to compensate for the higher health insurance cost. So
Mm.
that's what it happens in the reverse. As healthcare costs go up, then our wages go down to make up for that, right? So at least in theory, if healthcare costs go down, then there's room for wages to go up. And again, your boss isn't going to go up to you and say, hey, my healthcare costs went down, so I'm going to give you a pay raise. But again, as there's turnover and companies are competing with each other for better employees, they have options to pay them a higher base salary. And what's interesting is this basically happened in reverse in 1942. Back then in 1942, we were in the middle of World War II, and all these eligible Americans were overseas fighting, and so companies had there was a lack of eligible American workers to fill their spots. So economists were afraid that all these companies would start competing for these American employees by raising their wages higher and higher and higher.
Mm.
And FDR got scared that this might lead to inflation, like hyperinflation, when all these companies keep raising their wages. So FDR, he froze wages with an executive order. So basically he told companies, you're not allowed to raise your wages to try to attract talent. So what companies started doing instead was, instead of raising their wages, they still had to compete with each other. So they started offering better and better healthcare, or they started offering health insurance as their perk. And so 1942 is when we started relying on employers for health insurance as a country. That's when it kind of started.
And
So
that's
as
why
you
we
can,
have the system right now. Sorry for interrupting, but
yeah, no, that's exactly why.
that's
Yeah,
why we have the system now where most Americans get their healthcare through their employer.
exactly.
Yeah.
Exactly.
Yeah.
Yeah. So, well, if you think about it, like, if in 1942 we already had single payer and FDR didn't sign that executive order freezing wages, then yeah, people's wages would have gone up, and healthcare would already be taken care of by the government.
Mm.
So, anyways, that's the first economic benefit, is it would actually increase your pay.
Well, so uh, it sounds like it would like it gives company like more leeway to increase your pay over time, or like if you wanted to go like negotiate with your boss or whatever, like you
Hmm.
just like they have more in the stores so that they can increase your pay.
Right.
And at the very least, if they're not increasing your pay, businesses become more profitable and like the boss's pay increases or something like that. But there's just like the companies are not spending that money on
Mhm.
healthcare. Like they're saving that money on healthcare, and that could lead to increased pay.
Right.
Yeah.
Right.
Okay. Got it.
Yeah.
I mean, it seems like it would also kind of I think it seemed like this was like the third point that you wanted to make about it, but it just seems like a natural thing to touch on right now. But it seems like
Hmm.
this would also, right? Like if I don't, then if the government is a source of my health insurance, and it's not my job that's the source of my health insurance,
Hmm.
right? Then like I wouldn't need to worry so much about if I really hate this job that I'm in right now, or it's just
Hmm.
not inspiring to me, or if I have this idea, right? Like Andrew Yang, like on the campaign trail, kind of tells a story, right, about like, hey, I wanted to like run for president, and
Hmm.
his wife was like, well, hold on, what are we gonna do about health insurance? It's like,
Hmm.
babe, like I want to save the country and have all these great ideas to do it, but like a little thing like health insurance, it's not little, but like the health insurance is going to
Right.
get in the way of my presidential aspirations.
Yeah.
You know,
Yeah.
like
For
I
sure.
remember I dude, I remember my wife was working at this company that she just freaking hated. She came home stressed every day, out of her mind. She was pregnant at the time, and
Oh.
right, and I'm self-employed, you know, so like it was kind of like, okay, she's like the for sure money, I'm doing well, that's cool, but then she's like the stability in the family in a way if things in
Yeah.
my business kind of like go to crap and go to hell, right?
Yeah.
And so like uh, you know, like I feel bad about this, I really do, but I have a pregnant wife, stressed out about a job, I don't know biochemically what that's doing to my fetus, my unborn kid at that point, right?
Yeah.
Like, should she quit? Should she quit? Should she quit? And one of the things was, okay, where is health insurance going to come from? I'm going to have to pay for it. Like, I just know it's expensive. I don't even want to look into it. And she
Oh
probably
yeah.
stayed in her job for like 2 or 3 months, probably more, longer than if healthcare was not tied to her job, she probably would have left
Hmm.
sooner. And I probably would
Yeah.
have felt better about it. And I feel like less of a man saying that out loud, but that's a thing.
Damn.
Yeah,
That's intense.
that's a thing. Like to just
Yeah.
admit that, you know.
No, thanks for sharing, dude. Thanks for
Yeah,
sharing.
like I'm sure you had other things to to
No,
share
let's
about
talk
like
about
job
that
lock
right
and
now.
stuff, but like yeah, you know, like
No,
just
let's talk about that right now. So yeah, so that is one of the things that I think it's true, and anecdotally it is true that people are tied to their company because of health insurance. Um, and so that is the argument a lot of progressives make is then you're not going to stay stuck at a job that you hate, or a job that you're not that good at, but you don't want to leave that job because of the health insurance. And but when you kind of dig into the numbers, I'm just, all I can say is I'm not sure, right? I'm not sure because there was a Gallup poll done on employee engagement, and it
mm,
shows that only 30% of Americans are actively engaged with their job, which is like pretty damn low. Um, right. So
70% are just kind of like
yeah, they don't give a
doing
crap.
like barely getting by, kind of like I'm just here to
Yeah.
collect a paycheck.
Yeah, exactly. So 30% of Americans are like, they're involved in their job, they're committed, they want to make the organization better, they put a lot of energy and enthusiasm into it. The
Hmm.
other 70% are either like not engaged, meaning they're just not motivated, they're just there for a paycheck, or they're actively disengaged, meaning they're a liability to the company and they're actively unproductive and actively unhappy. So
Wow.
anyways, only 30% of Americans are actively engaged in the job. So that you would think like, okay, maybe that engagement level would go up if we had single payer or universal health care. But
Because
then
like
when
they
you
didn't have to be there
right,
because of
because they
okay.
can, yeah, they can move on to another company or another job that suits their strengths more. But then
Hmm.
again, when I looked at the numbers from the other countries that do have single payer, so for example, there's Canada again. and then there's Italy, and their employee engagement rate is only 16% and 14%. Right?
Are you
It's
kidding me,
even
dude?
lower. It's even
That is
lower.
low.
Yeah, and then like United Kingdom, or we were talking about England earlier because they have socialized medicine, and again,
Mhm.
they wouldn't have that healthcare concern. Only 17% of their employees are engaged. So, I mean, yeah, maybe I'm not looking at this the right way, but for me, I needed some way to kind of like prove this out. And when I look at it this way, it's like, okay, having single payer doesn't necessarily mean higher job satisfaction and more like moving around. But and
Yeah.
at the
Okay.
way it is right now, the United States has like one of the highest employee engagement rates in the world, which is kind of insane. Um,
At
so
30%.
yeah, at 30%, right?
Mm,
At
yeah.
30%. So I think it's one of those things where I can see it making sense. I can see that engagement rate going up even higher as a result of the government taking on healthcare. But maybe that's not like the only factor, especially in some of these other countries. You know what I mean?
Yeah, I guess when you compare it, it's I mean, so the correlation is not like a causality sort of a thing,
Right,
right?
right.
Like I wouldn't necessarily say that because people have to get health insurance from their employer, that's why they're engaged. Or actually maybe I don't know. Like I don't know.
Yeah,
Um,
maybe they're enthusiastic about keeping their job because that's the only way they'll have health insurance. I don't know.
so that's
Maybe
kind of
that's
dark
another
and
way to look
cynical.
at
Just a little bit.
it.
Okay.
Yeah,
Mm, okay. All right.
yeah. So I think, yeah, so like I said, like that's like maybe yes, maybe not. I'm just not sure.
Okay.
I'm
So
just not
that's
sure.
like on the employee engagement side.
Yeah. But overall, it is supposed to improve the labor market. So earlier you mentioned like, hey, we got these 900 health insurance companies, each with their own CEO, accounting department, all that. What's going to happen when we shut all of them down and consolidate it into one government entity? Aren't all these people going to lose their jobs? And it's true, 1.8 million people will lose their job as a result of it. But
That's
on
a
the flip,
pretty big number.
it is. It is. So I'm not trying to trivialize that by any means. Um, 1.8 million people will lose their jobs from healthcare administration. But on the flip side, there's going to be an increase in demand because all these uninsured and underinsured Americans are now going to have access to healthcare. And what that's going to do is that's going to drive up a demand for healthcare workers. So doctors, nurses, hospital workers. And the number of jobs created will actually be 2.3 million. So net, you're going to gain 500,000 jobs as a result of doing this. And, yeah, you can ask me, I think that's moving in the right direction, and I think, it's kind of like when Blockbuster was around and Netflix was coming on the scene. Yeah, you're not going to like ban the creation of Netflix just because you want to let Blockbuster employees keep their jobs. You know what I mean? So, and I guess my
Mm.
point is we're still moving in the right direction, and that's a necessary cost to pay. And for the 1.8 million workers that become unemployed, we could make sure we gave them fair compensation, unemployment benefits, training, whatever needs to be done to make it humane. You
Mm.
know, um,
And I mean, we're losing a bunch of admin jobs.
right?
We're gaining a lot of healthcare jobs. Will
Exactly.
those 1.8 million people who lost their admin jobs go on to become doctors, nurses, hospital workers? I guess like when I look at that, like I'm not sure. Like I feel like maybe not.
Yeah,
At,
maybe not.
yeah, I think at the same time, right? Like overall, like after this all kind of like stabilizes and shakes out, dude, like we gained like 2.3 million healthcare workers in America. Like I know that those jobs are actually just a lot more engaged. It's easier to be more engaged, right? And
Hmm.
find it to be like more meaningful, like the work that you do
Hmm.
as a doctor, nurse, or hospital worker compared to, right, like healthcare administration. And it's not to bash healthcare administrators at all. It's just kind of like you look at the nature of the work. One is a lot more um, like you're doing a lot more to help people directly.
Hmm.
Like I can see that also. I don't know how to quantify that necessarily, but I think that's a net positive for the country.
I think so. And the thing is, like, again, if you think of yourself, I guess, as a business owner of America, then you could think of it as like, yeah, do I want my healthcare dollars getting sucked into billing? Or
Mhm.
do I want to simplify that billing process so less dollars go into that and more dollars can go into taking care of the actual patients?
Yeah.
And so yeah, I do believe that's a net positive.
Yeah. And I mean, not to trivialize it, I guess for those 1.8 million healthcare admin people, like people that are in healthcare admin, I guess some of them, like they're just, uh, as a human being, like they're going to have to figure out what their next step is. So I think that is going to suck for them on some level, and they're going to have to figure it out. Like I wouldn't be surprised if they were opposed
Right.
to, right, like what
Right.
Bernie is saying, or right, it'd be scary for
Yeah.
them. I mean, overall, if you look at the bigger picture, that's like 1.8 million people who are going to have to figure out what their next steps are.
Yeah.
Um, and that's compared to 109 million Americans who currently are in like medical debt. What, like 10% of Americans, so like 34 million Americans owe $10,000 or more in medical debt. Like it just, yeah, like it, I want to acknowledge as a human being to those 1.8 people, to 1.8 million people, like, yeah, like I guess there's something that you're gonna have to figure out here, but like the net benefit is kind of like dwarfed by how many more people would be served by
Yeah.
this. I would say there's 28 million people, Americans. Well, there are 72 million Americans who are uninsured or underinsured. So
Yeah.
it's kind of, yeah, my heart goes out to those people. It's not, I mean, it's not like it's happening right now anyway, but like my heart would go out to those people, and kind of, I guess it would come down to like, how do you transition into that so that for these 1.8 million Americans, it's a humane transition somehow.
Yeah, I agree. I'm in favor of a humane transition, and I think that was being proposed for the single payer proponents as well.
Hmm. Okay.
So the final I, the last economic benefits, is it would, theoretically inspire entrepreneurship. So when you look at the developed world and our statistics, the United States, we have the lowest self-employment rate in the whole developed world, right? Our self-employment rate is 6%. Great Britain, again, socialized medicine in the United Kingdom. I mean, I guess they're the same thing. UK is 15%. Italy, it's 23%. So again, like these countries where the healthcare is kind of taken care of on a universal level, there just seems to be a lot more self-employment slash entrepreneurship going on. All the top
That's
countries
crazy.
have all the top countries when you look at self-employment rates, all of them
Hmm.
universal healthcare. Now, to be fair, I mean there might be other factors playing into this low self-employment rate and the reason I bring that up is Canada is, although it has single payer, it's only 8% in terms of self-employment rate,
Hmm.
which is only 2% higher than the US. So again, it's kind of like that job lot thing we talked about earlier. Like maybe,
Hmm.
maybe not. Maybe there's some other factors going on outside of it.
Yeah.
But like just the fact that we rank dead last and then we talk so much about small business and entrepreneurship and innovation
Oh
as a
yeah, we love that on the campaign trail. Just to
yeah,
paint that picture, it's really eye-opening to me that like we have the lowest self-employment rate. I mean, America, like we think of ourselves as like the innovators, the freedom lovers, and
yeah,
like, right, like you ain't really that free if you're locked to your job in a way
yeah,
because of health insurance. And again, like right, like when we're talking about like these economic effects, like it could increase pay, it could increase health, like no, it will increase in healthcare jobs, it could inspire entrepreneurship. This part is like a little less fuzzy compared to like the simplicity it would definitely do, the money it would definitely save, and the lives that it would definitely
yeah.
impact and save also. And like for these second order effects, it is harder to estimate, but like this is like what's possible on top of all those definitely awesome things.
Exactly. Yeah, yeah, yeah. That's why we wanted to lead with the three S's, right? But then these three I's, like they also get discussed as well. Um, so the thing is the single payer model is already being used in the United States, and it's being used for our Medicare program. So our Medicare program, it's healthcare for Americans who are 65 or older, right? So this is why a lot of people, they call single payer Medicare for all, because it's basically interchangeable. It's the
Okay.
same.
Because
Yeah.
that's what Medicare is that single payer, the health. The government is already in the insurance business for
Hmm.
this section of Americans right there. Like
Right.
it's not like it has to go figure this out. Like it's already doing that. It would just kind of scale out. Is that what you
Exactly.
mean? Okay, got
Exactly.
it.
Exactly what I mean.
Hmm.
Yeah. So no, so as we go into that, again, like in the spirit of honesty, we want to be as fair as we can about this topic. And there are some, problems with Medicare. So want to point out like three problem P's, right? So number one is it's poor, right? It's running out of money. Number two is doctors get low payments. And number one, it's poor. Number two, there's lower payments. Number three, there's more paperwork. So let's go over number one. Right now, it's poor. It's running out of money. The funds are about to be depleted in the next 6 years, according to a Medicare trustees report. And if you think about it, it's because back in 1965, when Medicare was first passed, lifespan for Americans was 70, right? So you cover them from 65 to 70, no problem. Nowadays, our lifespan is 78. So now you're covering them for 8 more years. It's more than doubled, right? The Medicare eligible population has more than doubled during that
Okay.
time.
I mean, so and that's the reason why it's like poor, because like the amount of money that's trickling into the fund somehow, like the percentage of taxes that's coming into it stayed the same, but then the amount of money that it's paying out because of the expanded
Hmm.
lifespan is more.
Yeah,
So, I
yeah,
mean, all right, so I get, like, I can see how that's a challenge, but I don't know if that's actually a problem. I mean, that's like a challenge, and it's like, okay, so then the solution is just like, all right, then turn this part of the faucet on a little bit more. Then,
yeah.
I guess, especially if you're going to scale it, but then you save all that money. But it's like it's not a fatal
Oh, I
problem,
agree. Yeah, so
right?
these are issues that we have to deal with at the very least, or these are things we need to fix.
Got it.
So I
Okay,
think
that
I
makes
think like
sense.
you said, like the taxes basically need to go up. And that's what all single payer proponents admit is at least on the front end, your
Mm.
taxes are going to go up
Oh, I
regardless.
can hear some people like angry at this already.
Oh yeah, for sure.
But okay, so yeah, I mean, like it's just like, come on, guys, like just to be systemically aware of what's going on. Like, it's just, unless you want people 65 and older to suddenly be like, hey, you actually have no coverage.
Hmm.
Come join all these other Americans that are uninsured or underinsured, and we'll see that spike then. So it's
Yeah,
kind of like, what do we want to do for our people as a country? It
yeah,
goes back to that question, I guess. Yeah.
yeah, for sure.
Okay. All right. And
Um,
I don't think anyone out there can really say, I don't know any old people. It's like, that'd be really hard.
yeah.
Okay, got it. So it currently is poor. Like, that's one of the challenges of the system.
Yeah, so things do need to be tweaked. We can't just lower the age and it wouldn't solve everything, right?
Hmm.
Additional legislation needs to be done, tweaks around the edges. Uh, Disadvantage number 2 and 3. So it's going to lower the payments to doctors. So right now, doctors get paid 80% of what they would get paid by private insurers as they do by Medicare. And also Medicare, it increases paperwork for doctors. So since it's government run and there's bureaucracy,
Yeah.
there's a lot more paperwork that doctors have to fill out. And this is why about a third of doctors say that they're no longer going to accept new Medicare patients, moving forward. And this is a poll done by the Commonwealth Fund, which actually has a liberal bias. So it says a lot that even the Commonwealth Fund admits, like, yeah, about a third of doctors are like, more paperwork for less pay. Like, no, I don't want to deal with this. So
Interesting. So
yeah.
I'm just trying to like do some math, just like reconcile everything that we've talked about so far. Doctors get paid about 80% less compared to
Mhm.
like with private insurers. And the thing with private insurers is that up to a third of the time they go unpaid for their work.
That's true. That's true.
So Yeah, I'm not going to sit around and try to do the math right now because the camera's on and we're recording, and it might take me a little long, but there is that. But yeah, I mean, the government is known for paperwork, right? So there is that.
Yeah,
Like, I can see how that's a downside. And I mean, that seems like a challenge for medical providers, not necessarily
mhm.
a challenge for my mom,
Yeah,
right?
yeah,
That's something for our medical providers to contend with and figure out, which they're people too. But
Mhm.
they have more of an incentive to deal with it compared to my mom anyway.
Yeah. I guess what it does show that is that there would be resistance again, um, you know, from that sector of our economy. So we got not only the
Uh-huh, yeah.
we got the healthcare administrators in the insurance industry, and then we got, our medical professionals, and yeah, there's going to be some resistance coming from both areas.
Like they have incentive to resist in a way.
Hmm.
Yeah, okay. That makes sense. That makes
Yeah.
sense.
But then again, like, so yeah, I guess the way to think about it is, okay, so Medicare is not a perfect system, right? It's not perfect by any means, but at the same time, we're probably going in the right direction. It's probably much better than what we have right now, regardless of.
Comparatively,
Yeah,
compared to like everything that we just named at the beginning of this episode, it would seem,
yeah, yeah,
um, but we would have to contend with these like pretty well resourced entities, the health insurance companies and like the medical establishments, I guess, the
yeah,
providers.
yeah. So, and the reason I point that out is despite all these issues supposedly with single payer, we got an increase in American doctors who are actually moving into Canada. Um, we got
What?
it used to be that Canadian doctors who are trained in Canadian middle schools, they would medical schools, sorry, would go to America in order to make more money, and they wouldn't want to stay in Canada. But nowadays there are more Canadian doctors who are returning to Canada as opposed to, immigrating to the United States. And like I said, like, earlier, it's because of all the paperwork, bureaucracy, and loopholes that already exist with their private insurance company anyway. And it's what you just pointed out, like 30% of doctors get unpaid, you know, uh, or doctors get unpaid 30% of the time in the US versus 2% of the time in Canada. And in fact, like family doctors get paid about $100,000 more in Canada than they do in the US.
Whoa.
So,
Whoa.
yeah,
So, like, the doctors actually make more. Well, family doctors that you just named, like, actually make more in
right.
can 100,000 more.
Mm-hmm.
Okay,
100.
because at first I was like, why are American doctors moving to Canada? I, I mean, like, that's a pretty good pay raise right there, even if it's in
Oh
Canadian
yeah,
dollars. That's
yeah,
still like 70 something thousand dollars more a year.
yeah, yeah. Sure. So, I mean, so it goes to show that basically the point is single payer, it does work. And some people, a lot of doctors specifically, are actually attracted to the idea of it. And yeah, like I said, it's not a perfect system, but there's definitely much better than what we have right now.
Yeah, it's kind of like it's crazy. Sometimes these metaphors that I come up with are kind of like, that's a crazy one, but just go with me anyway, right? It's like if you're if you're if you're homeless, you know, and suddenly you get an upgrade, like you get into an apartment or you get into like low income housing, and there's issues with it, right? It's not in the best neighborhood, not all the lights work, or stuff like that. Like, would you take it? Like, is that still an upgrade compared to before, or would you rather just kind of stay with the current system? um Again, not to say that single payer is like totally the thing that we must do, but come on, like,
Hmm.
come on, you know
Yeah,
why don't we have single payer yet? You know what I mean? Like,
yeah,
or something similar. Like, why are we still stuck with this current thing that we have right now?
yeah, exactly. And the funny thing is the original intent of Medicare was for it to be Medicare for all, right? But just because the Vietnam War was going on, there was a lot of anti-communist sentiment, which is why people were scared. The legislators were scared to push full out Medicare for all. But the hope was like, okay, we'll pass Medicare for now for Americans 65 and older. And then in the future, it'll eventually become Medicare for all. And, Medicare is super popular. It's got an 80% approval rating amongst users, as opposed to private insurance. It's only a 51% approval rating, right? And you can kind of see why. It's just the complexity and how much it screws people over. So Medicare it's for all its flaws, it's insanely popular amongst the people.
30% more popular amongst its kind of constituent base.
Yeah, which is pretty huge. So I think the question we're trying to answer with our next episode is basically Medicare is super popular. It was passed in 1965 with the intent of becoming Medicare for all, like 55 years ago. Why did it not happen yet? And that's the question we want to answer.
Yeah, and when I've had many conversations with Aaron about all this stuff, leading into recording this, and it's just really interesting, guys. Like, specifically, we came very, very close in the 40s. In the 40s, like before we even had Medicare, like we were kind of close to kicking the field ball, like into the end zone and having single payer. Like, this is 80 years ago. It's 80 years ago, right?
Yeah.
Here's some stats around it. In 1945, about 59% of Americans approved a single payer. Like, that was polled. Now check this out. 5 years later, in 1950, it was only 24%.
Mm-hmm.
So support for single payer healthcare dropped, what is that, 35%, from about 60% to like 24% within 5 years.
Yeah.
And that kind of like brought it to this point where we're still talking about it, like, hey, why don't we still have, why are we still not there? Like, something happened here that was just really interesting, and that's exactly what we want to spotlight in this next episode. I think when we start to explain all that stuff, it kind of like reflects to the politics of our times, and like what happened then, and you kind of like see what's still happening now around that. It's just really interesting. We want to put it in the spotlight just because I think it's an important part of the tale that I think without that context, some of the shenanigans that happens now, you swear it's so fresh and so real, and so.
Oh yeah. Oh yeah. We're gonna get into all that. So yeah. Thanks for joining. Hope you guys join us for that next time.
Yeah, hope you enjoyed this episode. Single payer, it's not perfect, but there's some clear advantages to it. Some really probable second order effects, and again, it's not perfect, but based on what you got from today, I hope it was at least eye-opening to you, and we'll see you on the next episode, everyone. Till then, stay going for woke.
Going for woke. Peace.
Hey, thanks for tuning into this episode. If you like getting woke with us, then subscribe now and give us a 5-star rating. And if at any point you thought, I wish more people heard this, you can spread the word by sharing this podcast with them. We appreciate it. Until then, keep your eyes, your ears, and your hearts open, everybody. We're out for now.